Well, hello and welcome. My name is Nicholas Hall, founder and president of Graham's Foundation, and I'm your host for today's healthcare industry chat with the founders of Sonura Beanie. I founded Graham's Foundation in 2009 in memory of my son, who died as a result of his premature birth. And our mission is to inform and guide parents of preemies so that they may confidently navigate the journey of prematurity. We provide support through our care package program, our Preemie Parent Mentor Program, the My Preemie mobile app, and our online community. So with that, I want to welcome a couple of the founders of Sonura Beanie. With us today is, coming up, Sophie and Gabby. Now I know that I think that there's two Gabbies on the team, if I'm not mistaken.
Yes.
So Gabby, are you Gabby 1 or Gabby 2? Or you're Gabby C? Or
I would say Gabby C and Gabby D.
All right, cool, awesome. Well, Sophie and Gabby, welcome to
Thank you
our
so much
healthcare
for
industry
having us.
chat. Yeah, so this is a little bit of a different. Normally, the chats that we have with folks from the industry are with a lot of them are companies that perhaps folks have already heard of, or they have products in the market. But this is actually something a little bit different. We're talking about a product that you're hoping, if I'm correct, you're hoping in the future to be able to take to the market. So you're two of the founders, but there's three others that are not able to be with us today. So maybe if you could share a little bit about your bios, your background, kind of where you are. I think you've graduated from University of Pennsylvania, and so kind of explain maybe a little bit about how the Sonura Beanie came to be, and then we're going to move on and kind of dive into the actual discussion of the vision for the product itself.
Yeah, for sure. I can take this one on. So we actually we were all bioengineers at the University of Pennsylvania. So even though we were all bioengineers, we met through other settings such as social clubs or Gabby and actually Caroline were roommates. There were a lot of different ways that we met each other through labs and stuff before that. And so as bioengineers, we decided to become a group as seniors. And through it's called Senior Design, but it's basically a senior capstone project. UPenn basically promotes us to find a problem and then create a solution through bioengineering to it. So when thinking of what problem that we could kind of address, we thought of all of our previous experiences. And actually, one of our co-founders, Caroline, was having a preceptorship where she shadowed in the NICU. And that's kind of where this issue of the sound, the noise, the environment of the NICU really first came prominent to us. So she kind of brought us this issue, and we kind of all brainstormed together. And that's where our product initially came from. And currently we have, so Tifra and Caroline are in med school, and the two Gabbies and me are continuing full-time. So that's kind of our background story.
Okay. So you're continuing full-time, and let's jump into the discussion slide. Because I think we're talking about, so you were one of the winners of the President's Innovation Prize. So you mentioned, some are a couple of the founders medical school, but full-time. So as I understand it, by winning this particular innovation prize, that actually provides some funding to give you the opportunity to focus full-time. Is that correct?
Yep. So it provided us some initial funding as well as salaries for the three of us who are continuing to work on this to really give this our all for the next year.
It's been an awesome experience. Just the leverage of Penn in general is super incredible. They give us office space. They give us some mentors. We're in an accelerator program. It's been a really incredible experience.
Wow. And I, as a former startup founder who didn't have any of that, I can tell you what a nice, it's just so valuable to know that you have some foundation, some grounding, to know that you have resources to be able to tap into, not just a little bit of money to pay a few bills, but also the network. That must be pretty incredible. So I take it then the the Innovation Prize. So that's a program that did you all like sort of sign up for ahead of time, and there were the 5 of you, and you knew that you were going to bring this idea to your senior year, or is everybody kind of expected to do something in your senior year, and it's what you kind of circle around and decide to focus on?
Yeah.
So the way that it works, pretty much, Sophie was mentioning senior design. So the Sonura Beanie really started as just like our school project. And part of the senior design curriculum is you need to find a mentor, like a clinician or someone who can pretty much like give you a little bit of guidance and like validate your problem. So as we were talking to different clinicians and nurses, we were overwhelmed by the enthusiasm for the product that we wanted to make. And it was really then that we kind of looked around and we're like, we should really do something with this. Like, this is a serious need that there really isn't a solution for right now. And so it was probably after the fall semester that we decided that we should try and take this as far as we can. So it was then that we started applying to a bunch of different university competitions, including the Innovation Prize. And we kind of just figured we'll see what happens. And we're just super grateful that everything worked out the way that it did.
Yeah, I would say that something unique about us, rather than not only being 5 female bioengineers and engineers just in the space, but we're actually some of the few winners that actually didn't have customers, or we were actually on the like newer development side than previous winners. I think we are the first winners of a senior design team like that started. All these other teams had started previously, but we really put in the work our senior year, and we really just full force. We learned a lot of business that we didn't know. We developed a business plan. We developed our product. A lot occurred, and we really had to push, and it was incredible.
So tell me, like, kind of where. So you've got the idea is, so initially you become aware. It was brought to you the awareness of the issue that that neonatal intensive care units are tackling with trying to manage the light and the sound and the environment for the neurodevelopment, right, of these babies that are born prematurely. And so tell me, just sort of, there's the initial idea, but then tell me more about sort of how, was it talking to a lot of different people? I don't know if you have any even pictures of, we can post that as well later when we post the interview, but is it literally a that means that we're losing the audio, but we're back.
I think you cut out a little bit.
So tell me more, I guess. I'm sorry, Sophie, go ahead.
No, sorry, I'm just saying you cut out for the past couple seconds, but I think you're back.
But yeah, so we can talk about kind of how
frozen again. We were frozen. So, but we're back.
Okay.
I think we're back. Can you guys hear me okay?
Yep,
okay.
Perfect.
Okay, could be a Wi-Fi issue on this end, but I know Nicole we can edit that if we need to. So tell me, just kind of like, I'm curious about, so it started in the fall, but I'm curious sort of the development. Tell me more about the development of the product through the course of the year, kind of what you've discovered, how it, how far it's developed. Just curious to hear more about that.
So we really started with the problem of the auditory environment in the NICU, and we thought a lot about how to minimize changes in clinicians' workflow, which is how we reached the idea of a beanie. Every infant that comes in is already wearing a beanie, so how can we make that better to offer even more protection than just temperature regulation? So that's when we came up with this idea of incorporating a filter within the beanie so that it blocks out harmful noise, but still lets in human voices. So we're protecting them from those high frequencies, but still, allowing the vocal contact that's critical to this period of neurodevelopment. We pretty much wanted to make it sound like you're putting them back in the room, that same kind of
Mm.
protection from the external auditory environment. So that's kind of where we started. And then as we were working on it and talking as a team, we figured, we can do more with this. What's another need? And so personally, my younger sister was a NICU baby. And so as I was reading the literature and all these things, like I could see more and more of her in the long-term outcomes. So for me, I really wanted to find another way to, improve that neurodevelopment. And I know a lot of our team members could relate to having a loved one in the hospital that you can be with all the time. And so that's kind of where the parental connection came in. It was something that we were all super passionate about. And we thought, right now there are ways to get information out of the hospital, to see your baby, like baby monitors, angel eyes, but how can we, change the direction of communication and let the baby know that their parents are thinking of them and there with them, even if they can't be picking them up.
I think what we additionally
So go ahead. Go ahead, Sophie.
I think what we additionally benefited from in terms of the development, as an engineering product, they give us this assignment. They say, find a couple of clinicians, physicians and things like that, and then just create a problem around that. But I think what we really benefited from was taking those, we interviewed like over 20 physicians, nurses, parents, and we really took the problem statement and developed a solution off of that, rather than just creating a solution for a problem that maybe didn't exist. And I think that's kind of the crucial point and where we ended up being successful in the President's Innovation Prize, in our other business competition prizes, and just even as a venture as a whole. We can't just create a solution where there is no problem. And I think that's where we really were able to thrive and excel.
No, that's fantastic. What are some of examples of when you talk about promoting the cognitive and the socio-emotional development of the newborn, but also protecting from the auditory hazards? Like trying to understand how does the Beanie sort of know, and I imagine this is probably where the engineering comes in, but how is it determining what to protect versus what to promote from a sound, I guess, from a sound perspective? And is that the right question to ask? If it's not the right question to ask, you can.
Yep, totally. So it's all our filters frequency based. So the idea is it's a beanie with earmuffs built into the sides to, generally block out the because there's decibels and then there's frequency when you think of noise. So to kind of block out the loudness, and then we have a microphone that feeds through our circuit that plays through the speakers within the earmuffs. So that based on the frequency that's coming into the microphone, the infant is only hearing levels that are safe for them to be hearing.
Interesting. And I know that there's connected to a company I know that's developing, they're developing a product to focus on sort of auditory, like beneficial auditory input for the premature brain, right? Because it's just this, it's so, as the parent of, babies that were born prematurely and one that survived and is now almost going to be 17, and other parents though that have fortunately been able to bring their premature baby home. The doctors and nurses, like, they want to keep the baby, they want the baby to be alive and they want it to thrive, but the baby ultimately leaves after 2 or 3 months. And there's, that neurodevelopment is something that they have no way of ultimately kind of knowing, did we do a good job? Did we not do a good job? They don't know. And it's hard. You can't look and you can't, you can't see it, can't feel it. You don't know until years down the road. And it's such a critical time. And there's so many unknowns. I'm curious with you talk about the product has a mobile application as well. Is that, how is that sort of interacting with, and I don't know where sort of the product is at this point, if you're, if there's a kind of a test product at this point, or if you're still sort of in the development of to get to a test. But I'm kind of curious to sort of understand the interaction between the physical product, and we'll be able to we'll include some photos of the prototype when we post this as well. But curious sort of the interaction between the mobile app and the actual physical product itself.
Yeah, that's a great question. So, this took a lot of work for us in engineering as not app designers and things like that. So it was a big learning curve for us. But so eventually how it worked and how we got it to work is, so we knew that we couldn't use Bluetooth because Bluetooth relies on proximity. And we want the parents to be able to be anywhere when they're sending these messages. So we knew we had to utilize Wi-Fi enabled interactions. So basically what the application is you open the app on your phone and then you record your message and then you send it, and it's kind of in a holding space. And we're using Amazon Web Services in our cloud. So you have a number tied to your infant's number in the NICU. So basically you send your message, and then whenever the doctor wants to administer it, they have your pre-recording and they administer it as an audio therapy. So it doesn't interrupt any feeding or any sleeping schedules or things like that. So Amazon Web Services has been really helpful for us, and its entire network, will be able to hold a ton of infants.
Yeah, fascinating. And is there, hospitals, healthcare systems, insurance providers, et cetera, they like to see, can you demonstrate the efficacy? Can you show can you prove the value? And so I'm just I'm curious from that perspective, what sort of feedback are you getting from either parents or clinicians? And as I mentioned as well, if you have, you're more than welcome to throw questions at me, although I'm a parent, not a professional, but I certainly am passionate about this type of innovation that can impact future preemies. So I'm just kind of curious from how do we know that this is working? How do we know that this is actually doing what we say it's doing and having, providing the impact and the value?
Yeah, thank you. So that's kind of where we're at right now. So we have a prototype that we made that came out of, as we mentioned, our senior design project. And right now we're working on making that something that is manufacturable and can be commercialized. And so right now, as we're working on that, we're also, trying to get into the hospital administration space and get a better idea of what they want to see. Because that's really like our big unknown right now. As we mentioned, we talked to a lot of physicians and nurses and different parents who were super excited about it, but they're not going to be the ones who are buying it. So
got it. So you're actually, so you're at this point, you need a neonatal intensive care unit that you can work with. Is that right or no?
Kind of. So we've partnered with the Pennsylvania Pediatric Device Consortium based out of the Children's Hospital of Philadelphia. And we've talked to...
I was wondering, you're kind of geographically located next to a pretty well-regarded and innovative neonatal intensive care unit. So I was anticipating that you hopefully had a friendly relationship with that particular institution.
Yeah, so we have a couple physicians at both Jefferson and CHOP, Children's Hospital of Philadelphia, that have expressed enthusiasm into integrating our device once we develop the correct ISO and all the federal regulations related to that and our FDA clearance. So yeah, we definitely have enthusiasm for our product. So once it's approved, we hope to utilize those relationships and be able to put them into the hospitals.
Yeah, that's awesome. So what do you guys feel like right now? What are some of the areas that you're focused on, right now? What are maybe if you have any particular roadblocks, if there are things that you're looking for that just, knowing that we're going to share this with parents and with other folks in industry might be listening and might have an opportunity to, if you could put also like a wish list out there of just, what are some of the key key things that you're focused on here in the near term?
Yeah, so right now, I think kind of as Gabby outlined, we're working with determining exactly what this process is of dealing with hospital administration, kind of what are the roles that determine if a device gets into a hospital or not. And then additionally, in tandem, we're working on the insurance side, what's reimbursable? How is it reimbursable? And in what ways does this incentivize hospital use? And how would this affect us? So we've been doing a lot of research, a lot of calls with different people, and a lot of learning just in general. The curve is super steep. It's been super fun though, learning all different sides of this thing. But yeah, I guess if we were to have a wish list, it would be different administrators in hospital positions that would be able to help us kind of talk to who is the pinpoint of exactly who we need to talk to. Like, what is this committee? What is it more than just a physician enthusiasm? Kind of things like that. But that's what we've been learning.
The answer is yes. Yes, it is. It will be, but that's a good start, because if they're scratching their head and they're not really sure what it is you have or what the value proposition is, then that's a challenge. So enthusiasm is certainly a great start. I'm thinking of just several folks that I'd be able to introduce to you all. I'm curious in the process. So there's the product itself, the engineering, like actually being able to bring it to market. The flip side there, you'll start to look at and start to have to speak to the business side of it, right? So I'm curious, the business plan, was that something? So you're not in it's not B school, you're in bioengineering school, right? So were there, did you have support? Do you have support in terms of developing the actual business plan? Tell me more. Curious about that side of it, because that's a reality. As you're bringing a product to market, unless you have the money in your own pocket, people are going to ask for a return on their investment, and so they're going to want to better understand the addressable market and how you're going to price it and how you're going to all that good stuff. So did you have to kind of dive into some of those questions during that last year?
Oh yes, we covered them all. So Gabriela Del Toso and I were lucky enough to have experience in consulting previously, and actually that was what we were going to pursue before we quit our jobs to pursue Sonura. And so we had a little bit of that background, and lucky enough, we both have experience in the engineering entrepreneurship minor and classes at Penn. So she completed that minor and had this relationships with all these professors, and I've been taking those classes as well. Basically classes on how to take your product into the market, how to develop your business plan, and utilizing that resource of professors. We actually brought one of them on as our main mentor for the President's Innovation Prize. So we discussed topics such as pricing and business plan and future funding rounds and things like that. And paired with our own research and organizations and accelerators like iCorps, we were able to really dive into those questions with a lot of knowledge and with a lot of help. And it was incredible for us to all learn. Like, we all learned so much from that process.
I'd say one of the biggest takeaways from this whole experience is, knowing who to ask for help. Bioengineering was a great start for making this product, but as you said, there's just so much more than literally developing a product. So having the support from so many different people within the Penn community and even outside of it has been just so incredible.
Yeah. So five founders, that's unusual, a little unusual, right? Usually it's maybe one crazy person gets another crazy person maybe. And then, so what are the pluses and minuses of having, a team, the size that you do, and have you sort of naturally kind of, divide and conquer? Do you have you're starting to assume some specific roles and responsibilities, or just kind of curious about that?
Yeah, I can go first. I think we can both give our input on this, but I'd say having 5 was incredibly helpful for the accelerated speed of the senior design curriculum. Because the way it works is you're supposed to have your minimum viable product done by the end of the fall semester. And you're really coming up with your like idea like September. So on top of other classes, you know, that's a lot to do in a short period of time. And so I think we did a really good job of, you know, breaking down the different aspects of our product, people's strengths, you know, conquering like what they could. And it also really helps that we were all friends before coming into senior design. And
you're all still
Tiffany-
friends now? Still friends
Yep.
now?
We are. So it also helped that Tiffany, Sophie, Caroline, and I all did junior year bioengineering lab together while Gabby was studying abroad. So we already had that teamwork experience and like kind of knew how each other functioned within a team. So I'd say that was like a huge pro for us in getting us off the ground.
Yeah,
And so for each
like,
of, so go ahead, Sophie.
Oh, sorry, not to interrupt, but I know no one wants to talk about this, but when there's 5 founders, though, there's inevitable conflict. And I think that having the ability to navigate that and working through it was super incredible and was just a lesson that we're all going to take for the future. It was really cool to kind of see how ideas met at each other and how sometimes they did it and how to navigate that. And then we also know that as, you know, our co-founders go off to med school, we like are going to utilize those connections for, you know, integrated into their hospitals. Like that's the goal. And that's kind of what we're really excited about as they pursue their, you know, pursue their medical degree.
Yeah. No, that's exciting. That's exciting. That's awesome. Do you have any, I guess, are there, again, if we could put any questions out to the parent community at this point, and, you know, I said, if you have any sort of survey along the, that you're looking to promote, we can certainly help with that. But just kind of curious on the, you know, what the interaction has been like with the parents, and how that's been helpful. And I guess just if there's, you know, any further input at this point in time that you're looking for.
Yeah, I mean, we're always looking to hear more parent experiences. No two NICU experiences are the same. And I mean, we just graduated college. We don't have the experience. I have the experience of being a sibling of a NICU patient, but that's so different from being a parent of a NICU patient, especially when parents are one of the people that we, you know, really want to benefit from our product. So I think we can share our emails, and honestly, any experience, we're super happy to hear and share and, you know, take that into account as we iterate on our current product. Sophie, if you have
I know. We've been doing kind of customer discovery surveys within the parent community, both within parents who have had NICU, children who've been born into NICU, and without. Just to have any of those parent experiences has been like incredibly crucial to the development and the continuation of our product, because again, you can't create a solution without understanding and listening to what the problem is. So yes, any support, any communication, any survey communication would be awesome that we could have.
Yeah. Oh, that's fantastic. Well, I have to tell you, any more questions before I'm just thinking of just, you know, different neonatologists, you know, that I know that are really passionate about the environment that the baby, that really focus on that. The neonatal therapist groups that I know, different, you know, companies like Angel Eye that have developed products that initially, you know, started as intellectual property that are focused on the experience of the parent baby. And so you know, I look forward to being able to provide some introductions, hopefully that are beneficial to you all. But any other questions before we wrap up?
Thank you so much.
Or anything else that you'd want to share with the community? You don't have to, but.
I don't think I have anything else to share, but I just want to say, you know, as early entrepreneurs, you know, as 3 females in the space who don't really always know what they're doing, I think it's awesome that, you know, we were able to connect with you and you have these resources for us. I think it's super awesome. And it was an incredible honor to be asked to be on this interview. I just want to thank you in general. This has been really meaningful.
Absolutely. I'm glad that we took the time to do it. I really am. So thank you.
Thank you. Thank you.
So,
Yeah, you hit it.
Absolutely. So before we wrap up today, I do want to take a moment to thank our longtime partner and supporter, Pampers, for their underwriting of today's healthcare industry chat. And thank you once again to Sophie and to Gabby and the rest of the founders of Sonura Beanie. And again, thanks again to Pampers and the Preemie parent community, most especially for placing your trust in us to provide you with the information and guidance to help you confidently navigate the journey of prematurity. So thank you.